You might remember having your hearing screened as a child, and the idea might bring to mind tones or beeps that were played in your ear, which you would confirm having heard by raising your hand or pressing a button. But that isn't the only type of hearing test out there. There are many, and the one that we're talking about today is used primarily with these populations. We're talking about an otoacoustic emissions test. The cochlea is a snail-shaped organ of the inner ear, and after sound travels through the outer and middle ear, it reaches the cochlea via movement of the stapes bone, which moves the liquid inside. As the liquid inside moves back and forth, so do these bundles of hair cells, which generate electrical energy that travel through the cochlear nerve into the brain. But those hair cells don't only pass on received sounds, they also give off their own unique response, which are known as OAEs. It echoes back through the middle ear and can be picked up by the OAE machine. And if these signals do exist, it means that the patient doesn't have any more than a mild hearing loss. This test is objective. In other words, it doesn't depend on voluntary patient responses. This is the OAE machine used at the Judd Layton Speech and Language Clinic. This rubber tip will go into my ear, and a green color here will indicate a good seal. While this tip is sealed, it is important that the environment is quiet and that I don't move my jaw, so the seal isn't broken and the responses aren't covered. The signal, which sounds kind of like video game music, ranges from 1000 to 8000 Hz. As the graph charts the returning OAEs, I don't even feel any pressure or anything in my ear. When I finish the test, I throw away the rubber tip. The rubber tips are disposable and aren't shared between patients. And that is what a pass might look like. All the responses were above the line, meaning that my cochlea sent back a signal for each frequency. It is important to test both of the patient's ears, right and left, because hearing loss may differ. An otoacoustic emissions test can be failed for a few different reasons, an issue with the inner hair cells being just one of them. Inner hair cells can die or degenerate for a variety of different reasons, including just being a natural degeneration as we age, due to ototoxic medications, due to certain diseases, or prolonged noise exposure over the lifespan. A blockage or other issue in the outer or middle ear can also prevent the machine's signals from reaching the cochlea, affecting the results. Some of which being blockage in the outer ear by either a foreign body or earwax impaction. In the middle ear, a broken or otherwise malfunctioning ossicle could be the cause, or just being filled with fluid, like an ear infection. And then this can affect whether someone passes or fails their OAE.